What is the big deal about losing teeth? I mean, I can still chew, I can still smile, it's not such a big deal. But what actually happens is when you lose teeth, you'll see that the back teeth, they start to buckle under the huge loads. So the closer you are to the jaw joint, you'll see that the teeth are also much bigger because they're having to carry much larger loads than the front teeth are. So when you take one tooth out, what that means is that the tooth at the top also becomes redundant. So it's like losing two teeth. So when you've lost two teeth, the load that you're now generating is coming from the back. So this tooth buckles under that huge load. So you can see that this tooth has also started to drift down because there's nothing stopping it from drifting down. And the same is happening at the back. This is called unraveling of the bite. So what? But what happens eventually, and when you're actually going to start noticing the problems, are when you start to have muscular problems. For some people, they get headaches. For other people, they start to chip teeth. So you might find that the teeth in the front start to crack. They might start to get crack lines or they chip, or the teeth start to drift forwards as they start to lose bone as well. And this is how your bite eventually starts to fall apart. You end up losing more teeth. If you then look at what happens when you lose the whole jaw, where you lose all the teeth, you'll see that not only do the teeth, the jaw shrivel away, but this is what the external manifestation is, where everything tends to collapse. So you must have seen this where people take their artificial teeth out called dentures, and suddenly everything collapses because there's no support. So this is what we want to try to avoid by dealing with situations when they're smaller situations rather than wait for things to go down that route. This is a great image which shows you when you have the tooth how wide that volume of bone and skin is versus when right next to it where you can see that another tooth that's been lost and nothing's there. You can see how much of that area has actually withered away. So now if you lose this and you want to replace this, it's so much easier because most of the volume's there. So when you're thinking about having an implant, if you go with a situation like this where you want to replace it, this is a much easier experience for you and it's much quicker end result when you get your tooth back.